I'm a child clinical psychologist, and I became interested in supporting kids and families through around processing traumatic experiences. So that was my initial interest in this sort of work. You know, thinking about how we can help kids and families heal from traumatic experiences in the best way possible, in the most healthy way possible. And so with that, I became very interested in looking at the science of trauma and the neurobiology or neuroscience behind the impact of trauma for understanding how trauma impacts kids, for helping to inform our intervention. So that was part of the foundation and kind of framework for the training experience I had in my interest in trauma. I think trauma is an important thing for us to think about on a societal level. There's a need to address and discuss traumatic experiences, and it's not something that we're normally kind of like inclined to talk about or discuss, but we know that traumatic stress is a public health issue, it's a social justice issue, so it's something that I'm very passionate about bringing to the conversation and dialogue when we're talking about health outcomes, psychological outcomes, and disparities in outcomes in different groups of populations. So it started, my interest in trauma and mental health started with the interest in just supporting kids and families and through the experiences that they've been through, and it's grown to be a bit more of kind of a interest in increasing the dialogue around how we discuss trauma.